His Excellency Prime Minister Cocker, General Nigar Khan, President Shahabuddin, Assalamu alaikum. Thank you for inviting me. It was quite a challenge to figure out how to condense a 1-hour talk to 5 minutes. So I think we'll do something different. So just to give a context, what is generative AI, or what is AI? The idea of AI is really how do you learn from existing data and have the machine itself come up with the algorithms to understand and tell us about what is happening in the data. There's one thing to predict, but also other things to generate. So what I'm going to show examples today is how we are using generative AI in healthcare space to understand what's in the images, in X-rays, mammography, CT scans, MRIs, and completely change how physicians interact with images. And the idea is to bring these expert knowledge that typically an expert physician has to the masses. How do we make this most ubiquitous across the globe, and how do you get it to rural areas where people can understand and have expert opinions available readily? So instead of doing a presentation, I'm just going to demonstrate some of the early work we are doing in the space to see how this actually works. So let me see if I can make it work. So it's a demo, so if it breaks, that's typically what demos are happening. So I'll open up the first case. It's a chest X-ray of a patient admitted in the hospital. I'm not going to tell you what's happening. It's here. I'm going to ask our radiology assistant, Eva, what's going on with the image. Hey, Eva, can you tell me the main findings in this study? It's going to process. Request going all the way.
Certainly, the main findings include the presence of a left approach pigtail catheter and a small left pleural effusion with associated findings that suggest either adjacent scarring or atelectasis. There is blunting of the left costophrenic angle as well. The cardiomediastinum appears unremarkable and the bony structures are intact.
So I want to know if it's improved from the past, or do I need to take the catheter out? Has the pleural effusion increased since the past exam? Brew effusion, so let's see, it'll figure it out what I said.
No, the pleural effusion has actually decreased in size when compared to the prior study. It was previously described as moderate and is now considered small.
And I can even, like, as a junior physician, I don't know, it's the middle of the night, do I need to take this catheter out, or do I need to have a surgeon come and look at it? Should I take this catheter out or leave it in?
Managing the pigtail catheter should be based on clinical judgment, considering the patient's current status, symptoms, and the reason for the catheter placement. If the catheter was placed for managing the pleural effusion, and there's improvement with only a small effusion remaining, removal could be considered if clinically appropriate. However, the decision should also take into account factors such as the likelihood of reaccumulation of the effusion and the patient's overall treatment plan.
So it answered like an expert, not just saying yes or no, but reasoning behind what it's thinking around that. And then you can stretch this even more, especially in context of Pakistan. I can even have a discussion with her like this. Assalamu alaikum, Eva. Iske patient ke फेफड़े में क्या बीमारी है?
वालेकुम अस्सलाम. पेशेंट के चेस्ट एक्सरे में छोटी सी बाएं जानब की प्लीवरल एफ्यूजन का पता चला है, जिसमें से मुमकिना तौर पर पानी या फिल्वॉइड कम हो गया है, क्योंकि पिछले मुतालिया के मुकाबले में वो मुअतदल से छोटी हो गई है. इसके अलावा छाती की गहराई, जो कि पिगटेल कैथेटर की मौजूदगी की निशानी है, भी मौजूद है.
I think I'm going to stop here just to show you. Thank you.